Hi guys, so this Helen open with us.
Because this
Ay, kita ko.
for banking or other fertility options before treatment, the patient is concerned about future fertility. So self-care, as we have discussed now, how to do self-care, self-examination, initiation of perform. So monitor side effects, nausea, vomiting. Nothing there na. So for those who don't know, undergo chemotherapy treatment. Also psychosocial support, psychosocial support. Address body image concerns that include hair loss and other physical side effects of chemotherapy. So provide emotional support, no? So especially now, right? For us men, if we know that we have this kind of cancer, like we're gonna overthink na wala, hindi na ako makanak. So provide emotional support. So health promotion, education and awareness. Teach men, especially those between age of 1 to 35, that we are the most at risk for that. The highest risk group, how to perform monthly self-examination to detect any lumps, swelling, or changes in the size and shape of the testicles. So provide information and symptoms. Educate men on common symptoms of testicular cancer, such as lumps, discomfort, feeling of epileptic scrotum, and spine back pain or abdominal pain. And then smoking cessation, pinaka-universal smoking, smoking, but like we can apply this in everything. Encourage patients to quit smoking as it can increase cancer risk in general. And then the lifestyle, promote regular physical activity, exercise now, balanced diet, eat healthy to maintain overall health and reduce cancer risk. So,
Yes, sabi nila
avoidance
ikaw
of
ang half
certain
guys dito sa
environmental toxins.
full.
So, advisement to reduce exposure to harmful chemicals, pesticides, and other potential carcinogens, especially if you know that your patient is working in a farm, they're using pesticides. If you're working on a factory, you're using a lot of different types of chemicals. So now before we go to our concept map, please don't judge me for this.
Over.
This is what I did, I don't know. So as you can see, here are the modifiable as we mentioned kanina. And so normal cells no, madamage na after that. The DNA will be damaged, and then it's about genetic mutation, abnormal cell growth, testicular cancer.
Ano?
Okay. That's it. And then after that, nursing uptake. So fertility preservation development. So nurses now play a critical role in ensuring fertility preservation discussions occur before the initiations of treatment that can potentially affect fertility. So this includes providing education about sperm banking, which should be offered prior to chemotherapy because as we all know, chemotherapy, radiotherapy, and all types of therapy can affect the fertility. So radiation and orchiectomy, removal of one or both testicles. So, orchiectomy. So nurses educate patients on the impacts of treatment on fertility, ensuring they have access to fertility specialists and resources. So now, we're done in our nursing update. Now we're gonna like these interesting questions. Muna yung gina-ask din sa mostly of most people who experience this cancer. These are the questions. Can a person with testicular cancer
Yes.
procreate or can he make someone pregnant?
Yes.
Who answer yes? Who answer no? Right. So the answer is yes. He can still procreate. He can still make someone pregnant. Like it depends. No, because like testicular cancer, it affects like some testicular cancer affects only one. So kung ano isa, makaano siya. But because of the chemotherapy and because of some treatments, it will lower the chances of the fertility. But ang important thing, if not like viable na sperm, makaano siya. So for further explanation, yes, it is still possible for a man with testicular cancer to father a child, as fertility may not be immediately affected by the cancer itself, especially in the early stages. So the fertility the ability to procreate depends on several factors, such as whether one or both testicles are affected and the overall health of the sperm. Testicular cancer typically affects only one cell as long as and not only one testicle as long as the other testicle is functioning normally and producing healthy sperm. So it is possible to conceive. Testicular cancer doesn't always impact sperm production right away. And many men with a condition still have normal sperm count early on. However, later stage cancer or cancer in both testicles reduce fertility. So, but in the worst case scenarios, if the cancer progresses, it could potentially affect hormone levels or sperm quality over time. In more advanced cases, where the cancer has spread or significantly affect the testicle, fertility could be reduced. However, even in these cases, conceptions may still possible if not viable sperm. So, another question: can frequent masturbation cause testicular cancer? Now,
Yes.